Welcome back. Well, today I am joined by Dr. John Hovanesian, who is here on behalf of Harvard Eye Associates. Well, welcome back. How are you?
Thank you, Lisa. It's great to be here as always.
And I thank you very much for coming in because I know you have a busy schedule. So today, a very interesting subject matter, mercury poisoning.
Yeah.
And you would wonder how that's going to affect our eyesight. So tell me a little bit about what mercury poisoning is.
Yeah, so late last year this became newsworthy because there was a story of a patient a woman in Minnesota who became exposed to high levels of mercury. And so we are getting a certain number of questions from patients about it. And mercury is everywhere. It's an element that's present in the environment, present in soil, present in all things, but usually in very small quantities. Where we tend to get into trouble is when we get exposed to some product or some thing that contains higher levels of mercury. And probably the single most common source that is dangerous is actually cosmetics.
Oh, isn't that interesting? I see. Sometimes we try to read that teeny tiny little print on the back of some of those products, and you just can't. But then also a fallacy, which you were telling me about, is that we don't necessarily get exposure to mercury through what we eat.
Yeah, so we can talk about that first. So what we eat may contain some mercury too, and a lot of people talk about fish and the concern that fish, particularly the larger fish, which tend to have, the swordfish and the larger bodied fish tend to have a greater exposure to mercury and greater content. In balance, if you look at the content of mercury in fish and what that causes in terms of health damage versus the health benefits of eating fish a couple of times a week, in general, it favors eating fish more rather than less. Now, some exceptions, it's better to avoid high mercury-containing fish, particularly if you're pregnant, and for small children because they're particularly susceptible to mercury poisoning.
Right.
But and the FDA and the CDC have on their websites lists of fish that have more or less mercury to guide, what variety you should probably buy.
Okay, so all right, so that's an internal situation. So what we're talking about today is external, and we're looking at cosmetics, and we can buy cosmetics anywhere.
Yep.
Right? You can get them at just about any store.
Yep.
And you can even get them sold at swap meets and things like that.
That's right.
So what happened? This lady was exposed. Is that correct?
So she was using a skin whitening product. So it's often skin lightening products, those that take away age spots and that lighten our skin, are particularly prone to contain mercury. But any beauty product that's applied to the skin can potentially contain mercury. And this is really difficult partly because of just exactly what you said. There are so many places you can buy it. You can buy it online, you can buy it at swap meets, you can buy it at stores. And the FDA regulates it, but they don't approve products for the use in the U.S. So there may be illegally sold products here in the U.S. that contain high levels of mercury, and sometimes it's labeled and sometimes it's not.
Yeah.
So, it's recommended for people, if you're using cosmetics, learn about what you're getting. First, always read the ingredient list because that is going to be if it lists mercury in any way, just don't use it.
Right.
And by the way, it doesn't necessarily say mercury. There's a word calomel that means mercury.
So how do you spell that for me?
C-A-L-O-M-E-L. Calomel is a word that's commonly substituted for mercury. Or it may say mercurous or mercuric, which are just ionic forms of mercury that they're still mercury. And those are the forms that bind to neurologic tissue and cause trouble.
Oh, boy.
And so you have to be careful about that. And as I said, a lot of them that have ingredients labeled don't list mercury, even if they have mercury in them. The woman in Minnesota who was affected, the local health authority tested some of her cosmetics. One particular product that didn't list mercury in its ingredients had 18,000 times the concentration that is allowed in the U.S. For a cosmetic product. So,
are they adding it in, or is it their machinery that is using? I mean, how is it getting in there?
Typically, it's added because it does have some benefits in terms of shutting down melanin production. and that's the benefit in terms of skin lightening.
I see.
So the product works, but there's no way that it's worth the trouble that it can cause. Would you trade your brain power to have to get rid of age spots?
Wow.
No. And remember also that the damage done is not just to the person who's taking the mercury containing product, using it, and of course using it on the skin is the same as using it. It goes right through the skin. But it's also a risk to family members. Because, for example, in the woman in Minnesota, they tested her children. Her children had 150 times the recommended concentration of mercury in their blood.
Wow.
A washcloth that you wipe your face with now contains mercury, and that doesn't necessarily come out in the wash.
Oh,
and so other people are exposed to it. Just the air, vapor of mercury is very dangerous. So
wow.
The best thing you can do is use reputable products, purchase through reputable sources. I would avoid swap meets for buying cosmetics. Yeah. Read the instructions. If they don't come in English, that's one red flag, whatever they say. But even if they do come in English, it's good to look at websites, cross-reference with other sites that might tell you that, hey, this is a reputable product.
Right.
Beauty products are very habitual. We tend to use what we like, and we continue to use it over a long period of time. And so the risk means that we have a responsibility to make sure that what we're using is not going to harm our bodies or our brains.
What symptoms was the gal having? Because I'm wondering we use eye products all the time.
Yeah.
And so was she breaking out in a rash? Did she have styes? What was it?
So mercury poisoning has a number of symptoms that are somewhat nonspecific. So irritability, a little bit just feeling tired, right?
That could be anything.
Yeah, could be 1,000. Could be not getting
that
your
was
coffee.
Me this morning.
Before your coffee, right? It can be just sort of forgetfulness. It can be a whole bunch of tiredness, a whole bunch of things that are nonspecific. If you feel like you have a change in your health, always check with your doctor. If you're at all concerned you may have been exposed to something, ask your doctor to test for mercury poisoning, because you want to know about if it's happening, and then you want to investigate and eliminate those sources in your life.
Wow.
And this particular woman, I bring this case up because she lost vision. It affected her optic nerve.
Oh my.
Neural tissue is attacked by mercury. It causes free oxygen species to damage the tissue. She lost some of her peripheral vision, and she'll never regain it.
Wow.
So,
a unique case, though.
Unique, but not that unique. We know that, for example, macular degeneration is linked to mercury exposure. Other neurologic diseases, Parkinson's, ALS, Alzheimer's, all can be associated with mercury poisoning. So this is an important problem that we face even in this country, where we think our products are safe, and we have to educate ourselves and protect ourselves.
That seems like every time you turn around, there's something else, right?
Something new that can kill you.
And it's difficult, as you mentioned, to pinpoint it and find it and try to protect yourself. So great information. Now, you mentioned the FDA and the CDC. Do they have the products listed that we should be careful about? Or?
There is not an exhaustive list of products. There are certain products I know that are listed as with warnings. But in general, it's better to find products that they sort of recommend as safe, or other websites recommend as safe. And you have to be careful. There's a lot of websites just promoting the sale of products. Make sure that it's not just a small number of places that it's being promoted, but that it's a widely accepted product. You're probably safe if you do that.
Okay. All right. Well, perfect. Thank you for the information and the warning.
Nice to see you.
You too. If you want more information about what we have just discussed, you can certainly contact Harvard Eye Associates at harvardeye.com, or call them at 949-951-2020. We'll be right back.